Well, hello. This is Dr. Whitney Mitchell and Colette Nies, and we're here with Coffee for Colette. This is the first episode, and it is kind of basically put together to talk to different professionals within New Braunfels and in the greater Comal County, just on their expertise and kind of what they've contributed to the community, and just to bring some wisdom and to bring light over people that live here and work here locally. So I want to say welcome, Dr.
Thank
Mitchell. May I call you Whitney? um, so I'll give a little background. Dr. Whitney Mitchell is a psychiatrist with a private practice in town in New Braunfels, and she's a pretty active member of the community. She's the co-founder of Science Fest, and she is a wife and a mom to 2 teenagers. And a little background, she graduated high school early and was in a Rotary Youth Exchange program and went to Argentina for a year. Then she went on to graduate in genetics with a 4.0 from A&M, Texas A&M, and then was in the top of her medical school class at the University of Texas Health Science Center in San Antonio, and I believe was in the Alpha Medical Honor Society there. And she did her residency and internship in psychiatry at UT Health Center, and then served at University Hospital, Audie Murphy VA Hospital, and BAMC Military Hospital in inpatient and outpatient for her residencies. I also did a part of my postgraduate chaplaincy hours at University Hospital, and it's a trial by fire learning to get around that hospital when you're first there. I mean, it can be daunting because it's absolutely gigantic. So I'd like to introduce her. I had a pleasure of meeting Whitney over a year ago through my sister Erica, and have just become friends. There's a group of us that get together, professional women, and gotten to know a little bit about your passion for neuroscience, as well as mental health care and healthcare, and helping educate others on those that knowledge base that you have. I will give a little caveat for Whitney. She dropped out of medical school for was it a year or a semester?
Yeah, it was out of A&M and undergraduate.
Oh, okay, sorry. And to sing Argentinian folklore in South America, and I was just like, wait, what? So she's very well-rounded with not only being an artist but as well as being a scientist. So welcome, Whitney.
Thank you. Thank you so much. What an honor to be asked.
No doubt. Well, so I kind of begin off with kind of what led you into medicine and becoming a physician.
Yeah. So I grew up in New Braunfels, and I've always loved the natural sciences, space, and fossils, and dinosaurs. I think we were probably the only 2 kids that went to bed with nighttime stories of atoms. My dad would read adult science books to us when we were little. I was 5, and my dad was reading the Book of Atoms and about Professor Leeuwenhoek, and so so my interest in science was really sparked very early. And then adolescence happens, and I think adolescence is hard for the majority of us, but I think especially in STEM, where women and minorities are really underrepresented, there just wasn't a lot of guidance of what to do to further an interest in STEM.
Mm-hmm.
And so when I got to college, I floundered. I did well in my classes, but I had 5 different majors in 2 years. And it wasn't until I met my husband, who was very goal-oriented. He has always wanted to be an engineer. He went to school to be an engineer, and he is an engineer. But he really helped me kind of flesh things out a little bit, and said, why in the world aren't you doing medicine? And so I thought, why not? And because I really didn't know that I could do it before.
Mm-hmm.
And I went in with the idea of going into family practice. I love the idea of the small town doc and knowing multiple generations of people and delivering babies, and really got to see everything. But the changing climate of medicine was that even family practitioners had to spend such a shortened amount of time with each of their patients. And so I really like how psychiatry allowed me to get to the root of so many problems, because so many people present with physical problems that aren't physical at all. I mean, they're caused by some conflict at home or trauma growing up. And so I really like that psychiatry allowed me the time to talk to people and flesh out problems more. That was really fun for me. So I went into psychiatry, and I really loved it. I love the opportunities. I love having my small practice, and it's been exactly what I was looking for.
And do you have a brick and mortar practice, or do you? How does that lay out in New Braunfels?
I do. So I have an office over on Hans Drive and Green Road, and I have been in New Braunfels for 11 years, but I've been at that location for 7. And I work with another psychiatrist and 2 other therapists in the office, and we all have our independent practices, but it's really nice because we can talk about cases, and confidentially, of course, but offer each other suggestions, refer to one another, work as a team, and help people from multiple different angles, which has been very good.
Okay. Well, so, and I'll leave a link when I post this online. I'll leave a link. Are you taking new patients at this time, or after? I guess I should say after this COVID.
I opened my practice up again because I had not been taking new patients. I've been pretty full, but I really wanted to do my part and contribute during COVID. So I opened my practice up again. And I'm probably taking about the last that I'm able to take until summer, and then probably in September I will start seeing new patients again. There's been a lot of need since March.
Mm-hmm. And so this is kind of one of the reasons I really wanted to kind of get into more of an in-depth conversation with you. I know that you have been really active and involved over the last few months in creating resources and access for people during the coronavirus pandemic. I think it's a testament to your compassion and love of what you do. And so Dr. Mitchell created, for the audience, created a website called New Braunfels COVID-19 Survival Guide, which is like a mental health care and wellness guide for those living in New Braunfels and around New Braunfels. And it has a really wide array of articles contributed to from physicians and pastors, social workers, artists, professors, etc. And then you had also put together a mental health care or a healthcare hotline for workers. And I know that has come full circle and is no longer needed in the area. But I wanted to ask if you could just kind of talk about both of those things a little bit and kind of maybe why you started them, and is the website going to continue and kind of evolve, or is it just kind of a here and now resource? And then
yeah, so thanks for asking. So the website was started shortly after March. I think that the information that we were getting was so contrasting. I was hearing from my colleagues in other parts of the country that there was this pandemic coming, that it was serious, that people were dying, that hospitals were overwhelmed. And then the contrast of there not being a lot of concern was really alarming to me. And so the very first blog that I put together was the idea of, let's clear up misconceptions, because I'm hearing and seeing a lot of conflicting things. And so it was just meant to be a factual, here's the facts about Corona, this is why it's important, even though maybe you're not at risk, maybe I'm not at risk of being one of those that's in the 10% mortality category. But this is why you and I should still be concerned about it in terms of our community. And that was very well received. And there were people that asked me to continue to provide information.
Mm-hmm.
And so I think from there, it was, as ideas frequently do, they kind of take shape. And I started reading more about pandemics. There are wonderful studies that were done and published back from the SARS pandemic,
mm-hmm.
That talked a little bit more about the mental health impact, and that loneliness, that isolation were really important factors in community mental health, and that PTSD and depression were very high in people who had SARS, caregivers of patients with SARS, and healthcare workers. And so from there, an idea kind of came together of how can we get information out? How can it be relevant to our community? And then how can we highlight some of the knowledge and talents of some really smart people that we have in our community? So if your viewers haven't checked it out, I really do encourage them to, because it's very inspiring to read some of these essays.
It's really, there's such a vast array of different voices on there. It's really refreshing. Yeah.
And you contributed an amazing one on gardening that really I could feel in my soul when I read it. It was just beautiful.
Ah, thank you. I appreciate it. So what do you think it'll keep going, or is it and kind of evolve, or how, or you just can't see that far yet? So
yeah, I think, starting it and naming it the COVID-19 survival guide.
Right.
The idea was self-limiting, and that was my intent. I didn't want to create a business opportunity from this. I really wanted to create a place where we could feel good as a community and know that there are people who have resources available, that there are people who are suffering in the same ways, that we're all feeling this collective anxiety together. And so really the idea is that this is going to be during coronavirus. Mm-hmm. Now, I think one of the beautiful things that has happened is all the collaborations that will happen in the future from, and then promoting some wonderful ideas. We have a colleague who is an author, and so being able to promote her book and then work with her in that capacity has been a lot of fun too. So I think the future collaborations are going to be a lot of fun, but no, I see this being a self-limited project that we can put to bed after we're finished with this pandemic.
And hopefully that will be soon. So you touched on that the kind of aspect of loneliness and fear, and as a chaplain, a lot of kind of the ministry of chaplains are a ministry of presence. And I know within this situation and this pandemic, the ministry of presence has been taken out. And normally the chaplain, and for the viewer, a chaplain often in a hospital, if a chaplain works in a hospital setting, they're integral part of the palliative care team, because they are usually the ones that have the discussions with the DNRs and out of hospital DNRs, those conversations that go deeper than just medical, that are more spiritual. And then also a chaplain, partly you realize that a lot of pain is manifested through the loss of relationship or unhealed relationships. And I know that you as a psychiatrist, I'm sure, deal with this on a daily basis in the healing of the body as a whole, that it's not just separated, that the mind and body are so connected, as well as with a higher power, if a person believes that, or something greater than themselves. So being that, I know me personally, I mean, I'm not sick, and but yet I have kind of gone back and forth with loneliness and anxiety and frustration and anger, and sometimes all the spectrums within one day, you know, that it's especially with the conflicting information that's out there with politics and, you know, local and, you know, whether or not you agree and then now lately with all this, oh, it's all a hoax, you know, Bill Gates is out to get us kind of thing. And I wonder if that kind of desire to blame someone, like the answering the why, well, it was created to, you know, that not knowing, that powerlessness that people can feel under a situation like this, I wonder if that has given rise to the kind of paranoia or conspiracy theories. That's kind of on the side burner. I guess one of the questions I wanted to ask is, how have people come together, and what are some ways that you would suggest that people help deal with their anxiety and loneliness during times of isolation? And while businesses are slowly coming back up, you know, the nursing homes aren't. There's a lot of people that are still distancing themselves and say, wait, I'm going to make a physical or a mental choice for myself to still create some space between me or my family and others, just for safety's sake, because this is what I decided to do. So I guess that was kind of a lot all at once. So what are the ways in which you feel that kind of isolation and social distancing have kind of contributed toward anxiety and loneliness, or strategies to deal with that?
Yeah. Yeah, it's really interesting because I think this is the first time that I've ever experienced this long-term collective anxiety.
Mm-hmm.
9/11 felt a little different. It was, you know, so fast. We all felt it, that insecurity, but then questions were answered, you know, to the public satisfaction very quickly. And then quickly we jumped into this, yeah, we're going to get him back kind of, there was a question and then an answer solution. And so to have this for the very first time, this collective anxiety that hangs in the air, there's nothing we can do about it. Even though some people might not feel that they feel anxious, even, you know, you might feel it when you walk out of the grocery store and you take a deep breath and realize, I haven't taken a deep breath for 45 minutes while I was grocery shopping. Mm-hmm. Not looking people in the eye anymore. You know, when you pass people by, looking kind of the other way so that you're breathing in the other direction. This anxiety that we're all feeling kind of manifests in a physical way sometimes. And so I think looking at the fight or flight response has been very useful, and understanding that the amygdala is constantly looking for danger, and then our brain responds in this this acute way of, how can I make myself safe? We become more hyper vigilant, we're wary, we're anxious, and all of that is really, really adaptive in the short term. And then, you know, you get the HPA axis going, and that's our longer term systems that get our cortisol up. And so now we've been collectively anxious for, you know, going on 2 months. Right. And that's a long time to maintain that anxiety. I think why that's useful to know is that there are things within our body. Our body has its own way of calming itself down. And when you know those mechanisms, we can employ them. And so the first one is oxytocin, and using touch, using contact with other people to be able to soothe our fight or flight systems. Whether
this is physical touch,
it's physical touch. And so if you can't physically touch people, you know, trying to be responsible about that. So maybe it's your pets, physically touching your pets and squeezing on them. If you live with people, take the extra time to have that good 20-second hug and allow the oxytocin to get flowing a little bit. But we still have oxytocin when we video chat. Now, oxytocin drastically goes down if we're talking about social media or texting, or even phone calls don't seem to to stimulate oxytocin the way seeing people and hearing people do. So getting that, any contact you can, and that's what I'm encouraging my patients to do. Whatever you can do, have 10-foot happy hour on your driveway, park 2 parking places away and chat with people. But we are social beings and we really need that social time. And I think that's a very important way for us to be able to complain, gripe a little bit, talk about our anxiety, and in that process we're soothing each other and soothing ourselves.
Right. Yeah, it's interesting. I read a study, this is years ago, probably 15 years ago, and it was on, it wasn't a lot, but it was increased oxytocin levels when you watch a TV show where you identify with a character and they talked about the show Friends and how some people identify with them as members of their own family. And so their oxytocin levels went up slightly. It was, and then it talked about not replacing human relationships with TV. But anyway, it was interesting.
I'm not sure about that study, but I'm not surprised to hear it.
Yeah. It was easily 15 years ago. But I always reached out. I think of it every time I hear that Friends tagline or that, well, so, being in Texas, I know that when I was with National Association of Social Workers, one of the things that I testified on a few times, not a few, quite a bit, was to improve mental health care in Texas, being that we're 50th in the nation for mental health care. We're actually behind Guam, which says something about kind of where we are and its relation to homelessness and poverty and how it's kind of a systemic issue. How do you think that kind of Texas underfunding and we don't have to get political in that sense, but why do you think it is that Texas is 50th, and then how has that kind of exacerbated issues during collective anxiety like today?
Yeah, well, I think you've hit the nail on the head with the funding issue. I mean, we pay for what we value, and in Texas, for better or worse, we value other things. We don't value mental health, and I think that has been manifested in so many ways. Homelessness, of course, our foster care system. I mean, we struggle in a number of ways. Mental illness has been so stigmatized over forever, but it's even third world countries and studies, mentally ill people tend to do better because of community support than they do in first world countries. And so there were a couple of key things that really were helpful. In 2008, the Mental Health Parity and Addiction Equity Act, which allowed mental health to finally be funded in the same way that any other physical condition would be funded. And so it allowed people to go and get coverage, go see therapists, and have that covered by their insurance if they had insurance. That was a pretty big advantage for patients dealing with mental health issues. And then the pre-existing condition requirements was a huge one too, because so many of these conditions are really chronic. They're lifelong conditions. And so if you have your insurance plan that's refusing to allow you to be cared for in this debilitating condition because you've had it before, that really decreased people's ability to reach mental health care. We also have a huge shortage of psychiatrists. I think that I've read that over half of psychiatrists are 55 and up, and so are probably going to be retiring in the next 10 years. And then only 4% of medical school students go into psychiatry, and there's probably a lot of reasons for that too. It is not compensated the way other medical professionals are.
Mm-hmm.
And I think it's stigmatized as well. So, COVID has really accentuated a lot of the lack of psychiatry. But I think just like so many other businesses, they've had some really creative solutions that has me feeling optimistic. So telemedicine has been around for a long time, but all of a sudden within a week, we all learned how to do telemedicine. I've done phone calls with patients in the past or a Skype appointment or two, but within a week, and all of my colleagues as well had switched all of our patients to some sort of telemedicine platform. It wasn't that difficult. It was something that we figured out. And I think a lot of businesses are doing the same kind of creative solutions.
Mm-hmm.
But the Texas Medical Board also loosened some requirements that we were allowed to now practice across state lines. And so people in some parts of the country now were able to pitch in and help.
A friend of mine in Baltimore, who's a psychologist up there, were saying that this is kind of, they think it's going to be the kind of push that toward HIPAA to kind of revamp the whole system to being more modern, in the sense of telemed, that it's kind of, I think what she said was, it's the old model that keeps people having fax machines or something like that. Having all those old things that no one has anymore, and I know that there's some, being that I've worked in a hospital and outside of that, I mean, I know that HIPAA can be pretty, and in some ways for great reasons for privacy, but it'll be interesting to see how that evolves with telemed and then going across state lines. And do you have an opinion about that, or is it?
Oh, I agree. Absolutely. 100%. It is really funny that we're the only profession, I think, that still uses fax machines, and we don't use them a little bit, a lot.
It's like this giant thing. What's a fax machine? What's that? Well, so since schools are not going to reopen and businesses are kind of slowly opening, and I know that now we have to negotiate challenges. Families, especially single parents, have to negotiate challenges to a different way of living and being, especially if a parent works and their children is, a school-age child is not in school. And then they can't afford, a nanny, or, there's going to be a kind of negotiation. How can you work if your kid's not in school and you're a single parent, or a one income, or even a two income that can't afford it? So now there's going to be a lot of shifts and ways of trying to figure out this kind of new way of being and living. And I was just wondering if there's some tools or strategies that you had that where people could deal with their, and I touched on this a little bit on the last question before last, but kind of how to deal with the isolation and the stress if they're not connected to a mental health provider or a health, how, because it's a lot. I know it's keeping your sanity among parenting normally is a lot. And so to deal with finances and isolation and stress and confusion and all these other layers that are put upon everyone now, kind of what are some strategies they could do, or if a person is new to mental health care and doesn't know or kind of has a stigma on what it is, kind of what they can do to seek it out, or strategies that they can use if they don't have insurance or if they don't have money to spend on that.
Yeah. So, I think that this collective anxiety, more than anything, is serving to destigmatize, but also is making so many articles and raising awareness that now it's become, I hope, more acceptable to feel anxious.
Right.
Because most of us are feeling it right now anyway. And so, I think if you're looking for somebody to support you with your mental health, the website's a really good place to get started. There is a page specifically dedicated to all the people in New Braunfels who are offering some sort of telemedicine, online counseling, and probably even more now are offering that than when we put the resource together. Psychology Today is another great source, and then there are places like BetterHealth, and then there's a new one. I can't remember what it's called, but there are several online counseling resources. In terms of low-cost mental health, some of those are pausing right now until they can get better established. There are absolutely resources in New Braunfels for people who don't have insurance or who are really struggling with serious mental illness. Bluebonnet, MHDD is one. River City Advocacy is another that really serve people that are struggling with mental illness and offer some really amazing services.
Right.
And then, basic self-care, so when I first see a patient and when I see a patient who is struggling, we go back to the basics, and they leave my office with a list of things that have nothing to do with medication, that are important for supporting mental wellness. And they're things like exercise. It doesn't take a lot of exercise. Going for a walk 20 minutes, 3 days a week, is enough exercise to have some mental health benefit. Making sure you're taking care of your sleep. If you're staying up until 2 in the morning and waking up at noon, it just makes it harder to self-regulate. Making sure that you're reaching out and having social contacts. We talked a little bit about that, but that is so important. Spiritual, and having some sort of spiritual connection. There are so many studies that talk about how much better our brains function with a spiritual connection. And it really doesn't even matter what your spiritual beliefs are, what religion you are. It is just having some sort of connection. And then I recommend that people do some sort of creative outlet. And that is just from personal life experience, expressing your creativity in some way is just a really powerful way of self-care.
Right. And for me, I had talked to you about this outside of this, but like getting in nature and gardening and feeling kind of the openness. I personally, my belief system and who I see God to be encompasses all of creation and all that exists, whether it be the mountains or the sand or the water or the trees or just all living beings. And so that connection for me is very empowering, and it's humbling as well to know that my problems are not so monumental, that it's just to see the spirit move. Native American theology, the spirit of God or the great spirit flows through everything. So it's to see that everything around you is divine, so to speak. So well, we're going to come to a close. I really want to thank you, Dr. Mitchell, for joining me with this Coffee with Colette, this first one we've had. So I will add links to her website and her practice, as well as Science Fest. We didn't really touch on that. Are y'all going to be having it? This will be the 4th year. Are you having it this year because of all?
Canceled for this year. So
okay.
And next year.
So we'll be looking for it for 2021. And so, and she posted a handbook for anxiety on your, and who was it? There's a licensed social worker.
On this group.
Okay. And that is posted on her website, and then I also put it on the Vote Colette resource guide for Comal County. And so is there anything you'd like to add as we close?
Thank you so much for having me. Thank you for bringing attention to these things. I think they're so important, and for people to know that there are resources and that there is support and there are people who are feeling the same thing. It's really important. So thanks.
You're welcome. And hopefully I'll get to talk to you again soon. So enjoy your day. And thanks for coming.
Thanks, Colette.
All right, bye-bye.
Bye.
I don't know how to turn this off.